Today I'm going to demonstrate to you how to set yourself up with good positioning when you're sleeping on the bed, particularly on your backside. First thing we want to do is we want to work with trying to get the head into a right position. Now right now, the way you're positioned, you have the pillow all the way down underneath your shoulders. What that does is that puts the entire head forward. And what we need to do is get that neck into a more neutral position to take some of the stress off that area. First thing we're going to do is we want the pillow to be in the right position. So I'm going to have the pillow slide back till it just about ends at the base of the bump in the back here, this protuberance back here, occipital protuberance. There's going to be a little space underneath where the neck and the table is. What we're going to do is we're going to fill that in with a small towel. What I do is I take a hand towel from the bathroom. I'm going to fold it once. I'm going to fold it twice. And then I'm going to fold it lengthways. So we got about 8 layers here. I'm going to stick this towel underneath the pillow, but partly where it sticks out from underneath the pillow and partly underneath. And what that means is I'm going to stick it up, just pick your head up just a little bit, and come back down. Now, do you feel that supporting you there?
Perfectly.
Okay. So right now what that did is that got your head into a better position. It's not pushing your head entirely forward. And then what you can do there is you can feel the support there. We don't want it to be completely underneath, because at that point all that's going to do is pick the head up. I also don't want it to be completely separate from the pillow, because then that's not going to give the support we need to. We want a gradual glide from the pillow down to the towel, which will help support the neck in a nice neutral position, which means that's less strain for the neck and much easier for you to relax at night. And that's probably going to help keep you in this position longer if you're more comfortable. And if you tried the other method and the folded way before was not working for you, what we can do is try a slightly different way, which might give you a little more support. Again, we start with the towel here. We bend it once like this. Now this time what we're going to do is I'm going to loosely roll it up. I'm not making it super tight until we get a nice easy roll like this. And with the same thing that we did before, we're going to take this towel, we're going to stick this slightly underneath where the base of the neck is, so that there's some support right down there, and definitely a little bit of a slope down from the pillow down to the towel, and that should hopefully fill in the space if you didn't have enough support before. The next thing we're going to do is we need to get the lower back supported. So what we're going to actually do is put some pillows underneath your legs. What I'm going to do is I'm going to try to take a couple pillows. I'm going to put them underneath the legs. I'm going to double them up underneath the knees to create a little bit of a bend in the knees, which should help to support the lower back. So the thing I need to do is I'm going to need to take a pillow here first. I'm going to take it underneath and put it underneath the thigh, pretty much from the buttocks down to the knees. Then I'm going to take another pillow. This time I'm going to go from the knees to the ankles. And again, we're doubling up underneath the knees, and then we're resting our legs in a nice relaxed position. And this slight bit of bending in the knees and the hips helps to flatten out the lower back. Now that should feel relatively comfortable, and then what it does is it kind of offsets all the weight. Your back feels supported. A little bend in the knee here kind of supports the back. Now the neck is a nice neutral position, and what that's going to cause for you to do is to get into a nice, easy, relaxed position, which means that if you can get in relaxed easier, you can fall asleep easier. And if you fall asleep easier, you can get into that deep REM zone of sleeping where a lot of the repair actions that our body does at night occurs. What we're going to do next is go through how to position yourself to be sleeping on the side. The first thing we need to do is we need to get the neck in a nice neutral position. And you want to be completely on your side here, so let's rotate to get that shoulder right there. It looks pretty good. And right now, this pillow, what we're going to try to do is we're going to put the pillow just a little bit back here. And there's a little bit of space between the neck and the table. So what I need to do is I need to take a towel, nice hand towel from the bathroom. And what we're going to do is we're going to fold it once. And then next thing we're going to do, we're going to fold it, roll it down rather. Nice and easy. We're not doing anything too tight. All the way down. And what I'm going to do is I'm going to take this rolled up towel and I'm going to put it basically under the base of the neck there, where it's slightly under the pillow and slightly sticking out. And when the person rests their head down, they should feel a little bit of a support in the neck there. The next thing we need to do is to get the hips, knees, ankles, everything in a nice supported position. I take 2 pillows. With the pillows now, what I'm doing is I'm going to support the thighs and the lower leg. I want to put the pillow in the direction of the bone that needs to be supported. So in this case, we're going to be supporting the thigh. I want the pillow to lay in this direction. So I'm gonna go ahead and put this in between the legs, right about there. And then we need to support from the knees to the ankles so that we keep everything in alignment there. And I'm gonna put this in between the legs here, doubling it up underneath the knees. Not putting any extra strain on the lower back. The last piece of the puzzle we need to do is to put something in the arm here, because we don't know, should this arm go here? Should this arm go there? It's very uncomfortable. So what I do is I take a pillow and I'll put it right into the armpit area, as if like the patient's trying to hug the pillow, and now this arm has been unweighted. This arm here on the bottom can be placed underneath the pillow, as long as you don't put it underneath the head, which will side bend the head. And right now, this patient is in a nice optimal position. You shouldn't feel like any one particular joint in the body is bearing too much weight. A lot of times you feel that in the shoulders, sometimes you feel that in the hips. And that's another reason why we tend to turn after 5, 10, 15 minutes laying on the side, and that's what tends to keep us tossing and turning throughout the night.